Hello, welcome back to my channel. Today we'll learn about how to manage a case with urge incontinence. Okay, management of urge incontinence. So in urge incontinence, if a patient came with urge incontinence, you'll first do midstream urine sample. Then you'll go for bladder dairy. Dairy is for 3 days. Okay, then you'll do some lifestyle changes. Okay, what are the lifestyle changes? You'll remove caffeine from their diet. Okay, water intake, you'll adjust the fluid intake. Okay, drinking habits. And if she's BMI more than 30, you'll ask her for the weight loss. Okay, these things you'll do. Then you'll go for bladder training. You'll go for bladder training. Bladder training is for 6 weeks. 6 weeks. Then if this is not improving, the urine leakage is not improving, then you'll go for medical management. Medical management is by OTD, oxybutynin, tolterodone, and darphenazine. Okay. If see once you give these drugs, then you'll ask her to come for follow-up after 4 weeks. Okay. So what you'll ask in the 4 weeks, the symptoms improved or not, or whether there is any side effects with the drugs or not. Symptoms improved and side effects are also there. Okay. So we won't give all the three drugs. We'll give only one drug. Okay. The other two are for standby. So if symptoms are there, side effects are also there, then if you are giving oxybutynin, then you go for tolterodone or any combinations in that way. Okay. If symptoms improve, side effects are not there, then it's good. Okay. You'll ask her to come after follow-up for after 1 year. Okay. If she's 65 years old lady, then don't take risk. Ask her to come after 6 months follow-up. Okay. If all things are improving. If symptoms are not improved and side effects are there, okay, there is no use of this drug. So you'll go for other drug that is mirabagrone. What is the other drug? That is mirabagrone. What is mirabagrone? Mirabagrone is a beta 3 agonist. Okay, so these drugs can also be tried. These are medical management. If this is not working, then you will refer her to multidisciplinary team. You can go for urodynamics. You can go for urodynamics. You remember urodynamics? I'll tell later. Okay, so urodynamics that study will do, and you'll go for botulinum toxin. What? Botulinum toxin. Botulinum toxin generally will give 100 units or something like that. And as they have urinary leakage in that, so we'll ask them to go for clean intermittent catheterization. Okay, intermittently they'll catheter them. Okay, then if it is not improving with this, then you'll go for sacral nerve stimulation. Okay, sacral nerve stimulation, and best is posterior nerve stimulation, posterior tibial nerve stimulation. What is posterior tibial nerve stimulation? So it is very easily accessible and least invasive. It is least invasive. So these can be done. Okay. If it is not improving, then you'll go for surgery. Okay. What kind of surgeries you can do? You can do augmentation cystoplasty. Augmentation cystoplasty. If it is not working, then finally is urinary diversion. Urinary diversion. What is difference between these two means? See, augmentation cystoplasty. See, these are ureters, this is bladder, right? So in augmentation cystoplasty, what happens is bowel will come and these ureters attach to the bowel. Okay, these ureters attach to the bowel and urine will come through feces. Okay, urine also comes through feces. Okay, that's about augmentation cystoplasty. So we are just giving a support to the bladder. Whereas urinary diversion means same thing. Ureters are kept inside the bowel. Okay, but this is came as stoma outside. Okay, that's about urinary diversion. So if these procedures are done, then you'll go for follow-up lifelong. Lifelong, we'll ask them to come for follow-up. Okay. Once again, I'll repeat this. So first, it is a condition where this is a condition where there is a urgent incontinence and how to follow up that patient. Okay. So if there is a urgent incontinence, you'll go for midstream urine sample. So in midstream urine sample, what you will do? You'll see symptoms are there, you will see leukocytes, nitrates, you will send for culture and antibiotics basically. Okay. If symptoms are there, leukocytes, nitrates are not there. Okay. You'll send for culture, yes or no? Yes or no? They're asking. Yes, you'll send for culture. As the symptoms are there, you'll start the antibiotics. Okay. If symptoms are there, leukocytes and nitrates are present, then you'll send for culture and you'll start the antibiotics. If symptoms are not there, okay. If symptoms are not there, then you will and leukocytes are present, you will send for culture, but as there are no symptoms, you won't start the antibiotics. Okay, these things are very important. So basic funda is, if symptoms are there, you start antibiotics even though you'll send for culture. If there is no report, then also you start antibiotics. If symptoms are there, start antibiotics. Okay. The symptoms are not there, don't start antibiotics. Even the pus cells are there, don't start antibiotics. Next, coming to bladder dairy, you'll ask her to do bladder dairy for 3 days. So you'll ask her to say how much amount of intake is there, how amount of output, if there is any stimulating factors and all. Those things you'll ask her to maintain for 3 days and come with the dairy. Lifestyle modifications is if caffeine, then reduce that, water intake, and BMI more than 30, you'll ask her for weight loss. Bladder training for 6 weeks. If these are not improving, then you'll go for medical. That is oxybutynin, tall, pteridone, then darifenacin. Okay, these are all anticholinergic, so they have that the side effects. What are the side effects? Dry mouth, constipation, in that way. These side effects are there. Okay, if these side effects are present, then you ask them for follow for 4 weeks. If side effects are present, then you'll change the drug. Even after changing the drugs, the side effects are present and symptoms are not improving, you will change another drug, that is mirabagrone. If side effects are not there and symptoms are improving, then good, it's a good one. Then you'll follow up for 1 year. If she's old age, then you'll follow up after 6 months. Okay, then you can change to mirabagrone, which I told. So mirabagrone is a beta 3 agonist. Okay, then you refer to multidisciplinary team. Botulinum toxin is given 100 units, and the clean intermittent catheterization is done for them. And if botulinum toxin is started, then you'll follow up at for 12 weeks. Okay, follow up at 12 weeks. Then sacral nerve stimulation, post-tibial nerve stimulation is least invasive. This is best. If answer it is there, then you choose this. Okay. Then a lifelong follow-up is done for augmentation cystoplasty and urinary diversion. This is about urinary urge incontinence. Next we'll learn about stress incontinence. Okay. So, because in case of stress incontinence, what is the first thing you should do? Those things. Okay. So, in case of stress incontinence, so if there is stress incontinence, then you will go for first thing is pelvic floor muscle training. Pelvic floor muscle training is 8-3-3. What is 8-3-3? 3 months you will do. Okay, 8 contractions. Okay, 3 times daily. Hmm? That and weight loss is also there. See, in case of urge incontinence, weight loss is here, somewhere around here, right? After bladder training and all. But in case of urge incontinence, if you go for stress incontinence, weight loss will come first. Okay. Then so first weight loss. Okay. I'm so sorry. So first is weight loss. Weight loss will come first. Okay. So in stress incontinence, first is weight loss. Okay. Then you'll go for pelvic floor muscle training. 8-3-3. Okay. If options is first weight loss, then you'll go for pelvic floor muscle training. Then you'll go for MDT review. Then if it is not improving after this muscle training and all, then you'll go for surgery. Okay. Surgery like CAR. What is CAR? Colpo suspension, augmentation cystoplasty. Okay. Rectal sling surgeries. Augmentation, autologous, sorry. Okay. C is for colpo suspension. Colpo suspension. A is for autologous rectal facial sling surgeries. R. R is for retropubic mid-urethral sling surgeries. Okay, these car surgeries can be done. If a lady saying that I don't want surgery, then there is only one drug in case of stress incontinence, that is duloxetine. That is duloxetine. What is duloxetine? It is a SNRA. Okay, you can go for that. This is the end. So stress incontinence is very easy. Stress incontinence is very easy. So first thing is you'll ask for weight loss and history, examination. These are all options are first. Okay. Then weight loss, then pelvic floor muscle training. That is 8 contractions 3 times a day for 3 months. Okay, 3 months. That is 12 weeks. If they ask, there is pelvic muscle training for even for prolapse. For prolapse also there is pelvic floor muscle training, but that is for 16 weeks. That is 4 months. Okay. Then MDT car surgery is done. If they doesn't want surgery, you can go for duloxetine. It's about two important flowcharts in urogynecology. Thank you.